Well, a warm welcome to this talk, Friday the 25th of June. Now, I'm going to talk about the changing situation in Europe mostly today, with the significant threat of the Delta variant on the doorstep of Europe, well, in the UK. And then we want to look at the changing symptoms of COVID-19 as well today, because the clinical picture, the clinical presentation, the signs and symptoms has definitely changed. And we'll be looking at that and how that varies in people that are unvaccinated with 1 and 2 doses of vaccine. Then if we have time, there's a large trial being launched by Oxford University on ivermectin. So we'll look at that as well. And after yesterday's meta-analysis that we looked at. So starting off with a bit of orientation from the English-speaking countries first of all. Well, it's really quite self-explanatory, isn't it? Australia, New Zealand, of course. Canada, cases coming down very nicely. United States falling very gradually to stroke flat. Ireland with a higher number of cases per capita, and again fairly level there in Ireland. The United Kingdom, well, really the less said the better. I mean, it's just a dramatic increase, isn't it? And of course, as we know, this is the Delta variant that's powering this increase. Now, what I want to look at now is how this is going to affect Europe. So we've seen these dropping cases. Now, here are just a few representative European countries. Germany at the bottom, Italy, France. I've left the United States on there as a comparator, so you can see if you're in the States where you are. You're kind of in the middle of the European average at the moment in terms of new cases. Belgium, Spain, the United Kingdom, highest, of course. But I'm afraid quite a few of these countries, in fact probably all of them, are going to follow a similar trajectory to the United Kingdom as a result of this Delta variant. Now let's look at that now in a little more detail. So Delta variant, first identified in October in India. So first identified in India. Now India went onto the red list. It was announced on the 19th of April. But there was a good warning in advance that 4 days later it wasn't going to be implemented till the 23rd of April. And of course, this meant that every flight between the 19th and the 23rd of April from India was absolutely packed. Prices went up, demand went up. And basically, there was too much notice given, I'm afraid. Whereas the difference with the Australian situation is they just cancelled the flight straight away. Now, United Arab Emirates imposed a ban from India flights or strict quarantine for India flights from the 22nd of April. France from the 24th of April. The United States, well, really, this is hard to explain, actually. They didn't put the India onto their equivalent of their red list until the 4th of May. So, you know, we were criticising the UK for being late then. And of course, on this channel, we were advocating stopping flights from India as soon as we heard about this so-called double mutation, as it was called then, before it was even called the Indian mutant. But of course, that didn't happen, and we are where we are now. Now, all this was during a mass surge in India. So again, it was a classic example of reactivity. The authorities here in the UK, UAE, France, United States reacted to the massive surge in India rather than anticipating it, but we could see it coming weeks before that, and we talked about that. Anyway, that's done now, so that's kind of why we are where we're at in the UK. Now, why, given that there were flights going to France, given that there were flights going to the United States and other parts of the world from India, why has the UK been so disproportionately affected? Because it has. We've probably got more India cases, India variant, Delta variant cases than there are in India now, in terms of percentages. It's 95% a Delta variant now in the UK. Why is the UK so disproportionately affected? Well, the answer to that seems to be that April. So why is the UK worst? Is it the worst or is it the first to be affected? Well, it's probably going to be the first. But anyway, we'll come on to that. So April, there was 20,000 people arrived in the UK from India in the first 3 weeks of the month. At least 20,000 people. And of course, March, there's probably about another 20,000 or something. So what this means is quite a few of these people would have been infected with the Delta variant, there was multiple introductions. So many people, there I am, many people positive for the Delta variant would have come to different parts of the UK. Some would have gone to Scotland, some would have gone to England, some would have gone to Bradford, some would have gone to London, some would have gone to Wales. So they went all over the place. So this meant there was multiple seeding events. Now, even if it's a highly contagious variant, as with the Delta variant, if just one case or two cases arrives in the country, then it's probable it's just going to die out. That's quite likely it's going to die out. But if you have multiple seeding events, pretty soon it's going to get to a super spreader who's going to spread it to a lot of people, and then it's going to spread significantly. So the reason the UK is worst affected or first affected is that there was multiple seeding events. I think that's the main reason for that. But I think, unfortunately, it is first because it is increasing now in the United States, as we know, and we're going to look at evidence that it's increasing in Europe dramatically now as well. So I think that means the UK is first. Would it have arrived in the UK eventually? Yes, of course. But if it had arrived a month later, we'd have millions more vaccine doses given. If millions more vaccine doses were given, then more people would be doubly vaccinated, and we know that's associated with a high level of protection. So was it a complete hash-up? Yes, I think it probably. Well, no question it was. We should have stopped those flights from India until we had the vaccine programme more advanced, but we didn't, so there we are. So now what's happening is, because of the errors of the United Kingdom, we are now an epicentre of the Delta variant in Europe, and it's now spreading from the UK to Europe. So in much the same way that the coronavirus originally spread from Italy, due to people largely going skiing way back at the start of the first wave. So UK's fault perhaps more this time than other times. Now, EU health officials are saying 90% of cases will be the Delta variant. They're pretty sure about this by late August. So it's increasing exponentially at the moment at the expense of other variants because it's outcompeting the other variants. So this is what's happening now. Now, Angela Merkel, Chancellor Merkel, has said Europe is on thin ice, direct quote. I assume she said it in German. I assume that's a translation. All member states should quarantine arrivals from the UK. Well, I must say I agree with Chancellor Angela Merkel 100%. All European Union or European countries should quarantine people coming from the UK because 95% of our cases now are the Delta variant. This is a risk to the world, to be quite honest. Angela Merkel actually said publicly headache and runny nose linked to the Delta variant. Now, headache, most common feature, runny nose, very common feature as well. We're going to be talking more about this specifically, so I'm not going to comment on that now. But a lot of people still don't realise this change in symptomatology, and it's still not reflected on the NHS guidelines yet, which is pretty slow and not really well reflected in the mainstream media. So do watch that in a few minutes' time. Now, European Centre for Disease Prevention and Control. Preliminary data shows that it can also infect individuals that have received only one dose of the current available vaccine. So one dose of vaccine, not a good level of protection, only giving about 33% protection, meaning there's still about a 77% chance someone can catch it, of course. So one vaccine dose, small level of protection against symptomatic infection. But they also say 2 doses offered high protection against the Delta variant, and this is the B1617.2 that we are talking about. So 2 levels of vaccine needed. Not only are 2 levels of vaccine needed, we need to wait for 2 or 3 weeks after the second dose. There's a long delay effect on this. France, so Germany's on thin ice, Europe's on thin ice. France, Delta variant in the southwest of the country. In this Les Landes region, 70% of the cases are Delta variant already. Nationally, 10% of cases are Delta variant, but we know these are probably going to double. The doubling time is about 7 days in most situations. So this time next week in France, I would expect nationally the Delta variant to be 20% of cases. Then a week after that, 40%. Then a week after that, 80%. And of course, you can see from that, it's not going to take long for us to get up to the 90% that the EU officials are predicting. France only 30% fully vaccinated. So really, what that really means is 70% of the population have quite a predisposition or potential to be infected here. Only 30% fully vaccinated. President Emmanuel Macron, we should all be vigilant because of the Delta variant is coming. So he's quite clear it is coming. It is coming. We see that it affects people who have not yet been vaccinated or have only had one dose, which means that we have to be even faster in this vaccination campaign. And the vaccination campaigns in Europe are speeding up, but as we've said, only 30% fully vaccinated. And even theoretically, if another 30% could get vaccinated kind of overnight, then it's going to be 2 or 3 weeks before they get the full protective effect from the second dose of the vaccine. Russia. Cases, another 20,000 cases in Russia alone in the last 24 hours, 569 deaths, so things are still high, even though we know these are, or they certainly were underreported. Highest figure since January in Russia. Moscow, the Delta variant, is now 90% of new infections. Now, what we've often seen in Russia is that the increase in cases, and in this case the increase in the Delta variant, starts in Moscow, then seems to spread out to the rest of the country. So Delta variant is now 90% of the cases in Moscow, accounting for the great increase in cases, and sadly we're starting to see an increase in deaths in Russia as well. And this will spread around the rest of the country in time. Could spread more slowly in Russia because, of course, of the vast distances and many remote areas. Now, Russian vaccination program is abysmal, to put it mildly. First dose, 12.8% of the population. Fully vaccinated, 9.9%. So 90% of the population are prone to getting the Delta variant. This is largely due to the very, very poor public relations that started the vaccination program in Russia. But let's hope people in Russia are realising now that this Delta variant is a real risk. 20,000 cases a day, getting on for 600 deaths a day, and that's going up. In Moscow, it's gone up already, and it's going to go up in the rest of the country. Let's hope this is a bit of a wake-up call for the vaccination program in Russia, because it would really be good to get a lot more people protected. Portugal, new restrictions in Lisbon, Tagus Valley. One or two other areas in Portugal, new restrictions. Delta variant, more than 50% of new cases in Portugal. So already we see it's taking over in Portugal, and in another week's time, 10 days' time in Portugal, that's going to be 90%, 95%, I'm afraid. One of the cabinet ministers in Portugal has admitted an attempt to contain the Delta variant could have been, they could have acted differently, is what they have said. So Portugal made a bit of a mess of it, not least by having so many British tourists. And of course, for a while, Portugal was on the green list because they had such low numbers of cases. They let Brits in because they depend on tourism for a lot of their income. And now they've got 50% of the Delta variant. Now, the precise phylogenetics, I don't know of those. I don't think they've been done yet. But I think we can pretty well assume that those Portuguese cases came from the United Kingdom. And they came to the United Kingdom from India because we didn't stop the flight. So we know the story now. Now, Euro 2020 football matches. Germany versus England in London next Tuesday. Friday today, so that's on next Tuesday. 60,000 fans attending, 75% capacity in the stadium. 60,000 fans attending. Germany versus England. People coming over from Germany. German World Medical Association comments on this. And they say, travelling to the UK runs the risk of getting infected with the Delta variant. I consider it irresponsible for even vaccinated people to travel to London in this situation, yet I'm sure tens of thousands of them will. And this is going to take potentially thousands of cases of the Delta variant back to Germany. Now, we have said previously that this virus, for example, when we saw a lot of protests in the United States, that was not associated with the surge after that because it was outdoors. But that was the original wild type variant. Then the UK variant, 40% more transmissible. The Delta variant, about 60% more transmissible than that. That means theoretically it's 124% more transmissible than the original variant, the Delta variant, more than double. It would appear from that as infectious, and it is looking like this one is spreading outside more so than the original ones did. So these mass participation events, a serious risk. In the light of the Delta variant, there's no real question in my mind that that game should be cancelled. Just put it back for a month or something till everyone's vaccinated. That could mean that there are multiple seeding events in Germany. And of course, the reason that the Delta variant got such a hold in the United Kingdom was the multiple seeding events from India. Now Germany seems to be allowing exactly the same thing to happen, and the British authorities seem to be allowing the Germans to come to UK to get infected. It just doesn't make any sense at all for the sake of a game of football. Cases will dramatically rise in Germany, I would predict, as a result of that, just exactly as we predicted on this channel that cases will dramatically rise in the UK as a result of seeding events from India. So they've got till next Tuesday to sort that out. Let's hope they do it. Evidence for that: Denmark asked 4,000 fans to get tested after a football game, again in the Euros. 3 people tested Delta positive last Thursday's Denmark v Belgium match. So again, we've got 4,000 fans, 4,000 Danish fans attended. 3 have so far tested positive, all with the Delta variant, and looks like they picked this up at the match. All 3 thought to have been infected by the Danish authorities at the match, presumably outdoor, or of course with the venues, the burger bars, the cups of tea, the bars, the toilets, everything that goes with this. So it's a dangerous situation. Now, the UK, of course, we've looked at the increase. Click on the site, and it's a bit depressing actually at the moment. Cases are up, hospitalisations are up, deaths are up. Cases up quite a lot, as we saw on the graphic. Deaths and hospitalisations up less, but up some. So, UK in the grip of the Delta variant at the moment, thankfully transposing into less hospitalisations and deaths. NHS COVID app is up and running now, so I've got a COVID passport sort of thing. What do they call it? COVID pass, I think they call it. And Boris Johnson has said fully vaccinated people offered a good way forward for resuming travel. So it looks like this app. So if you download if you're in England at least, if you download the NHS app, you can then put your COVID pass on it, and it will have your vaccination status on it. So because I've been fortunate enough to have 2 doses of the vaccine now, I've got a full COVID pass. Now, I've actually gone on a bit longer than I meant to there discussing those European issues. So I think what we'll do is the new signs and symptoms for COVID-19. I'll do those at the start of a next video, because a lot of people only watch the first few minutes, and I think that's really important information to get across. So we'll put that bang at the first of the next video. Then hopefully it'll reach more people, because I think it's really important that people learn about the new clinical presentations that we are seeing now in COVID-19 and coronavirus 2 infection. So thank you for watching this one, and we'll be back soon with that information.